it's very unequal from my perspective, and it's about who can access this type of technology, and how much you have, and how much you understand the technology, and how you understand it works. So there's all these inequalities that are present in the healthcare sector when it comes to technology.
Hello and welcome to the Global Digital Futures Think Tank, brought to you by Global Digital Futures. This is our YouTube series where we discuss topics related to our podcast series. And in this session, we'll be talking about developments in AI in healthcare on the African continent. So joining us today, we have Ncube, a doctoral research fellow at HUMA, the Institute of Humanities in Africa. We are joined by Amina Alaoui Soulimani, also a doctoral research fellow at HUMA, the Institute of Humanities in Africa, and Issah Samori, a data scientist at minoHealth AI Labs. So just to kick off, maybe each of you would like to sort of give a short overview of the project and how they are sort of discovering how AI is being used in the health sector on the continent. Maybe we can start with you, Amina.
Thank you so much, Chipo, and hello everyone. So yeah, my research looks particularly at artificial intelligence algorithms that are being used to diagnose cancer in Moroccan hospitals and the various underpinnings and challenges that come with that. But I'm also very much interested in sort of tracing the assemblage or the networks of who develops the algorithms, of how the end users interact with this very foreign technology often that says something about how their health is, or where the illness is located within their bodies. So I'm thinking along with ghosts, you know, algorithms are black boxes. It's an opaque sort of space. So how do we understand that opacity, and how do we navigate it? But also, so yeah, again, branching out to the larger questions of who is funding these algorithms and what is happening. What is happening with the data? Who does it get sold to? Especially that we're speaking, or I'm trying to inquire about genomic data more specifically. Yeah, I think in broad terms that's very much what the project is about at this particular moment in time.
Yeah, thank you so much, Amina. Really interesting points as well about who owns the data, what's being done with the data, and yeah, who controls that. Would you like to go ahead, Minentle?
Thank you for inviting us for this topic. Very topical conversation at this point in time. So my research is on the AI of healthcare situated in the DRC and Zambia, both of which share a history of extractive mining and cross-border health-seeking patterns. And I've been an anthropologist since the start of my postgraduate years, and I've been familiar with some of the works in post-colonial Africa, such as those of James Ferguson, who talks about the development and mining in that area. And I think at this point in time, it's interesting to ask questions on what materiality and urbanity and progress looks like in the stage of technology, which is what I'm asking in my own PhD. And to be more specific, my questions are around inequality in technology and the landscape that promotes that inequality, and the ethical frameworks that are embedded in these questions. Given the state of healthcare and very unequal access to healthcare, but also in terms of technological development, it doesn't happen very equally or broadly as compared to, say, where I'm situated in Eindhoven in the Netherlands, where technology happens very very fast, everyone has more access to healthcare technology, and in the African space, it's quite the opposite. It's very fragmented, and these are the questions I am asking, and I'm kind of wondering what it might look like in the future, or what forms of ethics we might need to take when such technology is fragmented. I don't have all the answers, of course, but I'm hoping to understand the landscape a lot better throughout the research.
And Issah, you're a data scientist, so actually like more on the technical side. How are you using technical solutions then for healthcare, particularly AI?
So first of all, I'd like to thank Chipo for inviting me onto this panel. So at minoHealth, we develop AI solutions for radiology problems. So first of all, one of our main problems we're looking at is developing AI models to predict chest conditions like pleural effusion, cardiomegaly, and pneumonia. And so we have a couple of models in the pipeline that do this. But the problem with this is, looking at this part of the world, we don't usually have data from this part of the world, from, let's say, Ghana, Africa. So you end up building models that are trained on data from the western part of the world. So we have models trained on data from western part of the world, but we're also working on collecting data from this part of the world, from the southern part. So now we started with Ghana. We are focusing on Ghana. We are working with a couple of health institutions to collect data. So when we get the data from these health institutions, then we start building models that is tailored for Africans or for the global south. So that's one of the projects we have at minoHealth. Another project we are considering seriously is AI for malaria research. So we believe there's a certain Ghanaian population who are quite resistant to malaria. So what we did was to collect the antibody and cytokine data of these populations, and then we analyze them using machine learning approaches or AI technologies to understand what set of cytokines or set of antibodies could be causing the resistance in this group of populations. And also, so I'm going to also do a lot of things. So let me also just say one last thing. So again, in addition to collecting the data from this part of the country, we're also working on a focus group with UN and ITU, and which is AI for healthcare. So we are working on creating global standards and benchmark for AI solutions. So just like, let's say if you have a medical device and you want to bring out a medical device, what do? You go to the FDA and you get a medical device approved. But if you have an AI solution, you don't have any standards or any FDA to approve your AI solution for you. So that's what you are doing. We are also trying to create global standards and benchmarks for AI solutions. That's basically what I do. I'm going to help.
Great, thank you so much, Issah. So you've all touched on some considerations, like key considerations: who owns the data, technology development, even probably digitizing systems and extracting data effectively. So it sort of makes me question, like, how are AI technology solutions being integrated into existing healthcare systems on the ground? Maybe you have some examples in the regions or countries that you're looking at.
I'll answer that. So typically, if you want to analyze a scan, or if you have a problem and your doctor asks you to go and take a scan, so what you usually do is that you go to the radiographer, then the radiographer takes a scan of you. It could be your brain, your arm, your chest. Then the image is forwarded, is sent to the radiologist, and the radiologist will read the image and generate a report from it. Right? So what we are looking at with our health institutions is that, so instead of having the radiologist solely grade the image, we have an AI system. The AI system will grade the image, and the radiologist also grade the image. And because you're in the very early stages of the AI, in the very early stages, we don't want to outsource the solution or the grading entirely to the AI system. So we have them working with radiologists. So the AI system will give its prediction, and the radiologist will also give its prediction. So at the end of the day, we get to learn how the AI system is performing as compared to the real radiologist. So that's, I think, one of the ways we are deploying AI system in radiology in Ghana here.
Minenhle, you mentioned that there's differences within the countries that you're looking at, and those challenges of tech development. So how are you seeing solutions being integrated?
Well, solutions are integrated in different ways, and they're not widespread. As I mentioned, they're happening in pockets, some of which are happening in private institutions, as opposed to governmental hospitals that are still using old-fashioned paper-based data capturing. But there are some startups who are developing apps that are used by individuals to, say, monitor their pregnancy timeline. And there are some NGOs and private companies that are working in primary healthcare to use software that's developed, some of which is developed outside the continent to help diagnose chest diseases such as COVID and tuberculosis. But this is happening in very few more private institutions. And so, I mean, it's very unequal from my perspective, and it's about who can access this type of technology, and how much you have, and how much you understand the technology, and how you understand it works. So there's all these inequalities that are present in the healthcare sector when it comes to technology.
And just to jump as an addition to that, are you seeing, you said the countries you're looking at is Zambia and DRC, right?
Yes, correct.
Some comparative or differences between the two countries? I don't know what their stages of development are, or funding in this area from the government or other people.
Well, before I start the fieldwork, what I see already is that the political status really determines the state of the economy and advancement in many areas. Zambia is very different to the DRC politically, the latter having a history of more ethnic violence and a lot of instability, which doesn't attract a lot of foreign investment, as opposed to Zambia. Zambia attracts a lot more people to develop technology. This isn't to say that there aren't any technological advancements in some areas in the DRC, but what I'm trying to say is that on a broad scale, there's political instability that does play a role in determining the level of technology advancement and adoption, and that's very critical I think in a lot of African spaces, a lot of African countries. But I thought I'll have more answers to this question when I really get into the field site and delve into the area.
Thank you so much. And Mina, what are you seeing in Morocco in terms of the adoption and implementation of AI solutions in healthcare?
Thank you for that question. So I think in the Moroccan context, and specifically with cancer diagnosis, I think it's mostly microbiology labs who are deploying the AI to do the genomic sequencing and to track the diagnosis. But as Issah mentioned, I think a lot of those AI systems are fed with Western data, because a lot of the algorithms which these microbiology labs are working with have not been developed in Morocco. They've not been developed by Moroccan software engineers or coders, and they've mostly come either from Germany or Switzerland or the US. And I'm really thinking about what Amina said about the inequalities and who has access. We are experiencing hospitals that have a very much dilapidated infrastructure. And the idea of having a digital medical report has been a priority, because the country's developed a project in 2008 called Digital Morocco, and the aim was to digitize like all the infrastructures. But there's the de facto de jure kind of situation. What's written in the development yearly report is not necessarily what's happening. The doctors are not being paid, the nurses aren't, and with COVID, the inequalities have been are shown even more clearly. And I think what's happening is that we're kind of living in a state of waithood. There's the imagined future hospital that will have, or that has, these AI technologies present, but sometimes the trainings aren't there. So a lot of the medical staff doesn't necessarily know how to store a digital medical report. Sometimes there's a lack of staff. So I think this is crucial to just think about. People die in waiting rooms. So I think, the contrast thinking about the AI technology that's going to be developed in a space where people don't have access to the bare amenities of welfare is kind of interesting to navigate and to see where do those resources actually go. But no, I also just wanted to mention how a lot of new hospitals are getting built, the imagined future hospital. But again, will it be accessible to everyone? Also considering that a lot of hospitals that provide cancer diagnosis or have oncology wards are quite a few within the country, and they're not spread out. So I think, to answer your question, I think the deployment of those AI technologies in healthcare is mostly happening in microbiology labs or in private clinics, which serve the Moroccan bourgeoisie or the foreigners or the expats who can afford it. So it's definitely an economy and not necessarily a public facility that is accessible.
Thank you so much, Amina. And I think all three of you, you've touched on some sort of ethical considerations, whether it's, for the most part, it sounds like class, but as well as politics. And when you were speaking, Amina, or actually, and Issah, when you were saying that the data is usually coming from the West, and even maybe the technology itself, like the actual solutions, it makes me question then, what are the strategies or approaches to then sort of decolonializing these solutions? Because if they're coming from the West, that could be an issue. And what are other ethical concerns then, especially around data ownership as well? Maybe you want to go ahead, start, Issah?
So about decolonizing this algorithms. So first of all, as I mentioned, we are working with certain health institutions to collect data from these health institutions. Then we can actually train our models on this we can actually train our models on the local data we collect. But again, before we do that, and working with health institutions in Ghana here is really difficult, because most of the hospitals, again, the data, they don't have, the data is not digitalized. Most of them are paper-based, so we need to find a way to digitalize the data. And even sometimes we might get to some hospitals, they don't have the data. So getting the data, it's a tedious process. So there are a lot of techniques we deploy, we use in building the models that actually help in decolonizing the models. So one of them is, so say you can train a model on data from the West, but you test the model on the few data you've collected from this part of the world. So if it is doing well on that data, so it means that, okay, you can generalize that the data will do well on African patients or patients from Ghana or Morocco. Yeah, so that's one way we decolonialize them. So on the case of, on the issue of inequality, so I'd like to say, so most of these institutions we work with, as Amina said, are private institutions. because getting data from government institutions is really difficult. Even some of them don't have the data, they don't have the infrastructures to keep their data. So yes, and the institutions that are deploying our AI models. So it's like a barter trade relationship. So they give us the data and we give them the AI models to help them with their diagnosis. So you realize that most of these models we are deploying are being deployed to the private institutions. So it's like you're cutting off the public institution. But I believe that over time, when we have enough data, we can deploy to all institutions, whether public or private. So for the ethical issues, I feel like the inequality is there in the sense of the class inequality, because it's only the private institutions and the experts that would have access to the AI models.
Yeah, it seems like with many other types of technology as well, it sort of exacerbates the existing contextual issues that are underlying anyway. And yeah, Minenhle, what do you see as some of the key ethical concerns in your research?
Just drawing from what Issah and Amina have just said, I think the ethical issue of bias is just exacerbated by the lack of available data on the continent. When we can't harness the majority of the population's data in public healthcare, which is what they can access, then inevitably there would be some bias that goes into those trained data sets from the private sector and the solutions that result from that. And I mean, when I think about decolonizing that area, my mind goes very far towards just having political will. If our leaders have political will to enable innovation, to enable cross-border trade, the boundaries that we are living in kind of limit our extent of innovation and building infrastructures that work for us, that political will really can go a long way towards having better digitized infrastructure in hospitals, harnessing all that big data for ourselves to train it more effectively and apply it to the solutions that are at hand. So, I mean, yeah, I think decoloniality also speaks about the people that are in charge. Are they willing to take part in this fourth industrial revolution progress? Because they really are very pivotal towards development on the continent, I think.
Thank you so much, Minenhle. And Amina, I'll just pose the same question to you as well about decolonization in this space and what you're seeing.
Well, to be honest, I don't think there is much to add to what Mimi and Issah have said. I think for me, I find this a very, very hard question because it's not a transparent system. Like, we don't know what's actually happening. And I think it's interesting to think about it as plotted within a larger global sort of system of surveillance of the post-colonies and of African bodies and regulations. So I think it requires a lot of forces and fostering to create the enabling environment for innovative solutions, as Mimi said. But to me, as an anthropologist who's yet to enter the space as well, I'm still trying to understand what it's about actually. Like, what is an AI system at the basic level of understanding? And yeah, there's a lot of talk and we think we understand it, but what has been left out of the conversation, and what is it that these big corporates don't want us to know? Yeah, so I think these are the questions that I'm knowing, and I consider perhaps these as a first step of inquiry within trying to actually understand how to go about the decolonization aspect and the decolonial praxis of it.
Thank you so much. So yeah, talking sort of about decolonization and what Minenhle, you mentioned about the leadership, you know, sort of driving this as well. What do you think are the types of policies and regulatory requirements that are required, you know? And are you seeing any like positive, I don't know if I say positive policies or yeah, just, I don't know whether positive or not, or just policies being shaped around this? Yeah. Maybe we could start with you, Minenhle.
At the moment, I think there aren't significant policy frameworks that are being shaped for the better usage of AI on the continent. I think at the moment we have some policy frameworks that are limited within borders, such as those that cater for Zambia, such as one that caters for South Africa, like the POPI Act, and others that cater for respective countries. But I think that in order for a more consistent framework to work for Africa, there has to be better collaboration with not just within countries, but between research, entrepreneurial space, and the political space as well. If those three work together towards building and understanding technology and the social space, that way we would be able to craft policies that work well for not just a country, but a particular region. Because if we just have a political framework for just South Africa, then the neighboring country is not really participating very well in the technological space. So I think collaboration between countries and within these three different areas, academia, entrepreneurship, and governments, have a big role to play in shaping our frameworks in AI. Just as I see here in the Netherlands, they have an EU framework for AI. It's not perfect, but it's a good step towards better AI usage and protection of people. Yeah.
Yeah, thank you for that. And also for bringing up that it's sort of a multilateral approach is needed, like with different players, basically. And Issah, in terms of like maybe where minoHealth is situated, and in Ghana as well, are you seeing any policy changes in this space? Or even, I know Darlington does do some work in, you know, advisory and etc. How is maybe minoHealth as a company also contributing or collaborating with different organizations in that space?
Okay, so looking at Ghana specifically, I've not seen any policy frameworks or frameworks being built towards AI, but I know as part of our topic with UN and ITU, so we are working on global standards and regulatory benchmarks. So I believe that on a global scale, right, we are seeing some developments in the regulatory side, because minoHealth, we are actually working on them. We are working on one, but it is not. But what saddens me is that it is not like it is specific to Africa or Ghana. It is on a global level. So I'm hopeful that with time it will trickle down to the global south.
Yeah, that's really important point actually, that global solutions still need to be localized. So you actually also need the local organizations to be active as well. I just want to jump at like a second question to what you were saying, Issah. Are there challenges or barriers for local players? I don't know, maybe in your context, just in terms of optimizing and even influencing and moving policies forward, you know?
Please, can you repeat the question again? I didn't, my network was.
Oh, no worries. I was just wondering if there are challenges in local context, just in terms of like operating and progressing policy, moving it forward.
So I think in the AI space, right? So the primary challenge in the AI space is data, and also the willingness of our leaders to accept this tech revolution, because day in, day out, we see a lot of money being invested into a lot of other things, but we don't see so much money going into the AI space and all that. So if the Ministry of Information, Ministry of Technology, all these ministries are not investing in the AI space, it won't really get people excited about the field. So you'd end up not getting a lot of players looking at regulatory frameworks. They'd rather look at other things that would be more not lucrative in a sense, but that would be I think that there will be motivation to do other things than coming up with frameworks in AI. Yeah, so I think the primary challenge here is funding. That's how I see it. I feel like it's funding, because if a lot of funding goes into the space, we'll see a lot of incredible progress.
Yeah, and Amina, I kind of wanted to pose the same question to you, because you mentioned that the project to digitize the health system started in 2008. So again, yeah, what are the sort of like blockers then in sort of progressing and further developing these strategies?
I would say lack of accountability, because, for instance, we have a huge institute that's I think it's called the Institute for like Data Privacy, but they don't do anything. They just have people who walk there every day to the office, and yeah, I think there's a lack of accountability, and there's a lack of proactivity in terms of trying to pick up the conversations where they need to be picked up. And at this point, I've realized that perhaps it's not enough to put regulatory frameworks that no one reads or that no one knows about or follows. You know, unlike Zimbabwe, Morocco's literacy rate is very low. And a lot of us, myself included, are sometimes confused about where to actually go and read about our rights and what the government needs to deliver. So I think that blurriness has sort of left us a bit behind, and it's definitely like a state apparatus kind of technique to just slow things down. But it's interesting to also know that something I've realized recently. So the GDPR regulations in Europe are actually also meant to protect the data of any person who they sort of have their data. So it's also interesting to know that if any of us knows or realizes that there's been a breach in any of these European companies, like how would we actually go and file a suit against them? Especially that you're not a European citizen, but you're someone in a village in Morocco who went to do a cancer diagnosis, and then your genomic data has been used for something else. So it's very much a blurred system, and I think there's a need to simplify the language of regulations and to actually provide them or present them in ways that ordinary citizens could understand, so they can actually hold the government accountable, hold these institutions that don't do anything accountable, and also make sure that we're able to track where all these funds are going, especially that with Morocco's geopolitical landscape at the moment, it's really prominent. There's a lot of foreign direct investment come through. There are new partnerships happening with Israel. So I think it's quite interesting to actually like just ask a question, what is happening? And I think at the basis of it is just really asking more questions to find ways to do the research that enables us to get a hold of what's going on. I just feel like the situation is just so confusing. And yeah.
Yeah, I mean, I agree that there's so many questions and so many, even just like when you were talking, Issah, about governments needing to invest and drive this. I was thinking that they probably don't have the necessary education either. There's a lot of sort of questions and maybe misunderstanding or lack of knowledge in the space as well. But we've, just to sort of round up and close our conversation, we've been sort of like very critically analyzing these technologies, these solutions, this space. What would you say are the opportunities? Oh, sorry, Issah, you have a question, and then I'll carry on.
So I don't necessarily have a question. I just have a contribution. So Chipo, you're saying that sometimes some of these government institutions don't have education or background to actually drive progress in this field. From my observation, I've realized that most of field in technology is usually driven, even in the West, it's usually driven by the private sector. So if the private sector works and creates, so like Google, like this, let's say AI, it was these big tech companies, Google, Facebook, doing their private R&Ds, and that drove a lot of progress. And then it became, then everyone else started adopting it. So I feel like the same could be done in Africa, because most of these private institutions can start investing a lot of money, can start investing a lot of R&D money into these fields. Then over time, so these private institutions will create their own regulatory requirements or benchmarks. Then we can see a lot of progress coming in. I don't know if.
Yeah, that's really valid. So, and I think like when we were speaking to Darlington as well, he did mention that technically, like in terms of implementation in the healthcare systems, the West isn't necessarily so far ahead of Africa, actually. There's a lot of research in the space where some countries are ahead, but actually implementation, across globally, people are still trying to find how best to implement these solutions. So from what you're saying, Issah, it sounds like there is a natural development that can happen from the private sector to other sectors in terms of the progress. But I think there's probably like specific, as we are saying again, local context and local considerations that have to be taken into mind. But yeah, I was just wondering, to close, I wanted to see what you feel are the opportunities that AI can bring into the healthcare space in Africa, bar like the considerations and issues that we're speaking about. We can start with you, maybe Minenhle.
My immediate thought is the pandemic, the COVID-19 pandemic. Technology on a very basic level has we have the opportunity to digitize healthcare more effectively. I've seen the rollout of vaccines very effective in a Western country where everyone's data, although there are some controversial questions regarding privacy, where everyone's data is on a database. And I mean, all I got was a letter inviting me to the venue of my vaccine appointment. And it was so easy for everyone for that organization to happen. But it wasn't so easy for countries where not everyone has a digital record. And it could be an opportunity for developing countries to think about how we might use technology to digitize our records so that we can access them when we need to in a crisis like a pandemic. And when that exercise book gets lost with all your information written down by the doctor, what's the alternative? So even if it's not an AI tool that is for prediction, that's for more advanced exercises, but just having a digital record really has a long way to go with just keeping it. If it's there somewhere, okay, whatever happens with for my physical records, it's fine. The digital record is very important.
Thank you so much. Issah, what do you think in terms of opportunities?
In terms of opportunity, a lot of things come to mind, but the first thing I would like to talk about is the issue of subjectivity. So you might have two radiologists, give them the same image, and then they will give you different diagnoses for the same image. And I was saying this actually happened to me last week. So my mom got a brain CT. They sent it to one hospital, they gave a diagnosis, and she sent it to another hospital and they give another diagnosis. So in this case, who do you actually side with? What is the objective truth? So I feel like if you have an AI system, so the AI system could be there to help guide the decisions of the radiologist. But there's also another problem with that, because again, we have a lot of issues around transparency in AI. Maybe an AI can give you a decision, you didn't know what is actually informing the decision. But then a lot of work has been done in the space of transparency. So let's say we get a transparency issue solved, right? And we have two radiologists giving different diagnosis on the same image. So you can have the AI system here that can actually break the tie. So that's one. And I also think, so the second one I feel like would be more towards research in healthcare. So for example, like AI for malaria or AI for malaria research. So Africans have been battling malaria for a very long time now. Meanwhile, in some of the European countries, it has actually been eliminated. So I feel like AI as a tool would help us tackle a lot of our tropical diseases. I'm also doing another work in dengue virus where we are using machine learning to find drug tag and to find novel drugs that can actually inhibit the dengue virus. So with AI, we can actually work towards eliminating these tropical African diseases, because a lot of Western researchers are not actually looking into this because it's not an issue that is bugging us, it is our problem. So AI can actually be a tool to get rid of these problems we are solving.
Great, thank you so much. Amina, what do you think in terms of opportunities from your research?
I think what I'm thinking about right now and at this moment is very much related to this idea that a democratized early cancer diagnosis could mean that we could perhaps and potentially reduce mortality rates, and also that perhaps regardless of your socioeconomic background, you can access diagnosis at much lower costs than if you had a lot of doctors involved, and also just really accessing care at the right time. I also have a hope or a wish about a potential opportunity, which is, to really decentralize healthcare access or cancer diagnosis access, so not necessarily having to travel to the other side of the country to actually get access to a microbiology lab and an oncology ward or an oncology space that can provide that diagnosis. So really shortening waiting time, decentralization, and democratizing access to diagnosis and care.
Great, thank you so much for all of the insights, and just it's a lot of food for thought, and yeah, wishing everybody luck with your research and your projects. Thank you so much for your time.
Thank you for hosting us, Chipo.